Dear viewers, welcome you all to our show OSA, that is Orthopaedic Solution Academy. Hope you all are well with your friends, family, and definitely with your patients. Dear viewers, today our topic is complex ankle deformity treated by Ilizarov. And the presenter is the very academic person from Kurdistan, Iraq, Professor Omer Barawi, sir. I would like to request Professor Omer Barawi, sir, to join with us.
Thank you so much. Thank you. Good afternoon, everyone.
Good afternoon, and thank you very much, sir, for joining with us. Dear viewers, we have three learned academic experts with us. One of them is the legendary Ilizarov surgeon from Bangladesh, Professor Mofakhkharul Bari, sir. I would like to request Professor Mofakhkharul Bari, sir, to join with us.
Thank you, Tanvir. Thank you. Good afternoon, everyone. Okay.
Good afternoon, sir. Thank you very much, sir, for joining with us. Dear viewers, we have another learned academic expert from Kurgan, Russia. That is Professor Novikov, sir. I would like to request Professor Novikov, sir, to join with us.
Good afternoon, dear colleagues. Good afternoon.
Good afternoon, sir. Thank you very much. And dear viewers, we have another enthusiastic Ilizarov surgeon from Patna, India, and that is Dr. Shamsul Huda, sir. I would like to request Dr. Shamsul Huda, sir, to join with us.
Good afternoon. Thank you, Dr. Tanvir. Thanks a lot.
Yeah. Good afternoon, and thank you very much, sir, for joining with us. Dear viewers, OSA, that is Orthopaedic Solution, it's a team, and we always try to do lots of works like a team. And today, one of our team members has born in this world and enlightened this world by born in this world, and that is Dr. Shamsul Huda, sir. We all like to congratulate and wish him a very happy birthday. Happy birthday to Dr. Shamsul Huda, sir, from Orthopaedic Solution Academy.
Thank you. Thanks a lot. Thank you.
And
very good. Very good.
This is a very simple
Wish you
gift.
all the best from our team.
Wonderful, wonderful. Thank you. You made my day.
It's a great day, and we all wish you a very happy and prosperous life. Thank you very much, sir, for being a part of Orthopaedic Solution Academy for last 1.5 years. And dear viewers, now I would like to request our honorable speaker, Professor Omer Barawi, sir, to share his screen and start his presentation. Professor Omer, sir, would you please share your screen and start your presentation, okay, sir?
Thank you so much. Try to show me the first one. Yes. Okay. I will start to welcome everyone. I would like to speak about recognition and treatment of complex ankle and foot deformities and how lastly it can be resolved by Ilizarov method. Next, please. Yes, these are some photographs of memory when I visit Kurgan also. Next one, please. Next one. Oh, I get benefit from this man, definitely too much, and even from his book, although still we have no English translation. Next one, please. Next. Probably you know this. Okay. Next one, please. Okay, regarding the clubfoot, any anomaly in shape of foot is known as clubfoot, but the commonest type is Talipes equinovarus. Idiopathic Talipes equinovarus is the commonest type, but some of them are complex, which cannot be treated by the Ponseti method. Next one, please. Yes, this is some characteristics of atypical or complex ankle foot deformities in which from the beginning one can decide this is not for the Ponseti. Ponseti, as you know, it is based on the gradual stretching and casting, but with gradual POP casting, usually within 5 or 6 POP casting at weekly interval. These are the main characteristics of the atypical clubfoot. Next one, please. We can see that the atypical clubfoot, it will be very fatty. The big toe will be hyperextended. There will be skin crease on the dorsum of the foot. Also another skin crease behind, above the heel and on the sole of the foot. And the main finding in atypical clubfoot is very tight, fibrous tendo-Achilles. Usually such cases cannot be respond very well to the Ponseti method. I'm speaking about the cases which are available in my region. Also, I'm a personal experience according to the availability of the instrument and implant and how now we can gain the Ilizarov frame. Next one, please. Next, please. Next. This is the Ponseti method. The main important point in Ponseti method is that the last component of the deformity which should be corrected is the equinus. If we are jumping for the equinus correction from the beginning, it will create rocker bottom deformity. So first of all, we have a correct adduction, then we are correcting supination. So with serial POP casting with stretching, it will be corrected if it is idiopathic Talipes equinovarus. But some of them are not idiopathic because of other causes, and some of them also from the beginning, the cases of fibular hemimelia. So the last resolution will be by Ilizarov method. Next one, please. Okay, next. I would like to go to the photo of one of my patients. Next one, please. Okay, this is very important before this one. Yes. When we are correcting, we have to hold it. One of the methods of holding for Talipes equinovarus is Dennis Brown brace. So the length of this brace should be equal to the length of the shoulder of the baby. So the feet should be in slightly abduction. And another important point is that during follow-up is that the heel of the baby should be fixed into the brace. Good number of the mother, they are coming after 3 months or 4 months. They said, in spite of I am using Dennis Brown brace, there is no benefit. The reason is that the hind of the heel is not fitted to the brace. So it is very important at the hind of the brace, there should be a hole to be sure that the heel is in the brace. Next one, please. This is one of my cases before 25 years, a case of bullet injury to the left leg treated by one of my friends. The wound is completely healed, but the mother, they brought the baby because of progressive shortening and eversion of the ankle and foot. This is due to the Salter-Harris type 5 epiphyseal plate injury. There were crushing of the lower end of fibula and the outer half of the tibia. So progressively, the foot will become everted and the tibia will not be growing similar to the sound side. The thing which was available at that time because of double embargo, some political situation. So I did arthrodesis of the ankle and foot to prevent recurrence of the deformity. And I put some bone graft from the patient himself. Next one, please. Next slide. Yes, please. Yes, now we can see that the foot is completely plantigrade, but it is shorter by 8 centimeters. The instrument and implant which was available at that time, some of the implant of Ralka from Cuba, which is bilateral rods. So I did gradual equalization of the limb till the limb became the same length. Next one, please. Yes, now we can see that the patient is standing without support with well equalized limbs. But I told her that when at maturity there will be recurrence of shortening, but there is no recurrence of deformity. As I did arthrodesis of the ankle. After 17 years, when she showed me in TV, she visited me in Suleimani. Next one, please. Now we can see that there is just shortening by 4 centimeters. As you know, this is known as reduction of deformity. Still now, she didn't agree to do elongation. Next one, please. This case is a case of acquired clubfoot because of trauma. One of the type of trauma, as you know, burn. So since childhood, there is gradual eversion of the foot, flexion deformity of the digits, severe flexion deformity of the digits, and supinated foot. Next one, please. Yes, the left lower limb was amputated by someone, and they applied artificial limb. So I started to do correction. This is without Ilizarov principle, and Ilizarov frame is impossible because we are doing gradual elongation of the tendon, nerve, artery, skin. Even the skin cannot tolerate acute correction. So I depend on Ilizarov principle and Ilizarov frame. Next one, please. Next one. These are just to make you sure about more finding of the foot ankle. Next one, please. Next. Now the patient is standing with support by his father with Ilizarov frame extending from below knee down to the ankle and foot and digits. Even the digits are involved in the frame to correct flexion deformity of the digits. Next one, please. Now you can see that plantigrade foot. So this was without principle of Ilizarov, and without Ilizarov frame was impossible to do acute correction, as we are sacrificing the mobility and the size of the foot if you are doing other methods. Next one, please. Next. Another patient came to me because of clubfoot for the last 5 years. This is because of soft tissue tumor compressing lumbosacral plexus. Next one, please. Next. Next one, please. You can see that there is soft tissue tumor against sacroiliac joint, wrongly labeled right and left. So I consult the spine surgeon regarding her spine problem. He's saying this needs just observation. Regarding the ankle and foot, I corrected by Ilizarov method and Ilizarov frame. Next one, please. Next one. You can see that completely plantigrade with the Ilizarov frame. Next one, please. Next. And now she is using night brace and she is engaged. She's married, because psychologically also the patient will be affected when you are correcting the deformity. Next one, please. This is a case of clubfoot treated by Turco procedure, American procedure, with recurrence. Because of the excessive scar tissue, it is not easy to do acute correction and to reopen. Again, I used Ilizarov frame and Ilizarov principles. Next one, please. Next one. Next. This is with Ilizarov frame. Usually such cases are cases of fibular hemimelia, mild degree of fibular hemimelia. Next one, please. Okay, now the patient is standing with a brace, night brace, without any sort of support. Next one, please. This is a case of poliomyelitis causing clubfoot. Not only shortening, wasting, severe equino-cavo-varus deformity. Next one, please. Even the patient was suffering from backache because of limbal discrepancy. Next one, please. Next one, please. This is the photograph of the patient, radiograph of the patient, confirming the finding. Next one, please. This is the Ilizarov assembly, how we can assemble the Ilizarov frame and to do gradual correction and equalization of the limb. When there is shortening, we will do also elongation of the tibia. Next one, please. Now you can see the patient has plantigrade position with shoes without any sort of support, with elongation of the tibia also. Next one, please. Next. This is a case of bullet injury, again causing clubfoot. After several surgeries, it was ended by tibia recurvatum, shortening, equino-cavus deformity, with clawing of the digits. Even the digits were clawed, intrinsic minus deformity. Next one, please. Next. Yes, you can see that the Ilizarov frame is extending from below for equalization of the limb, for correction of the recurvatum also for correction of the ankle and foot deformities. Next one, please. Yes, next one. Yes, next. We can see that even the digits are involved in the frame. Now, without frame, the patient is using just night brace for few months. Next one, please. So bullet injury is another type of trauma which causes clubfoot. Next one, please. Next. This is the radiograph of the patient. Next one, please. Next, please. We can see how I did corticotomy, not only for elongation, for correction of the deformity in the tibia. Next one, please. This is a case of cerebral palsy. Again, cerebral palsy is a good cause of clubfoot. You can see just from the posture and movement, we can decide that this is a case of left side hemiparesis because of cerebral palsy since childhood, causing limb length inequality and clubfoot. Next one. Yes, this case is also now he is using the frame for gradual correction. Next one, please. Sorry, thank you so much for everyone. Why I present these cases, these are the other causes of clubfoot, not only talipes equinovarus, and how the last decision can be done based on the principles of Ilizarov. Thank you so much.
Thank you very much, sir, for your excellent presentation. And I think we will be benefited by observing these cases. There are lots of difficulties in facing this type of cases. Now, I would like to request our honorable academic faculty, Professor Mofakhkharul Bari, sir, to say something regarding the presentation. Professor Mofakhkharul Bari, sir, would you please?
Thank you, Omer, Professor Omer, for presenting the good number of difficult cases. Can you hear me?
Yes, I can hear you very well.
Can you hear me?
Yes.
Yeah. So you've shown a very good number of difficult cases around the ankle. In your paper, just my one observation, complex ankle deformity, what includes in these? Number one question. And number two, have you done any kind of osteotomy in the calcaneum to go for the correction of the calcaneum and as well as the ankle?
Okay, thank you so much. Yes, the title better to say.
Do you follow my question?
Yes, yes. Better to say complex ankle foot deformities. It means multiple deformities in the digits, in the ankle and foot, even in the forefoot. And in none of my cases, I used osteotomy for the calcaneus. Okay. Okay, do you satisfied?
I think Bari sir can't hear you, sir. Okay, now I would like to request Professor Novikov, sir, to say something regarding the presentation. Professor Novikov, sir,
regarding the correction of the ankle calcaneum.
Really, I didn't do any osteotomy to the calcaneum. Probably they didn't need till now. Otherwise, it's a good choice.
My third question.
Yes, please.
Can I ask?
Yes, sir. Yes, please, sir.
Dr. Omer, thank you very much for your excellent results. And I think your patient is happy because you are a doctor. And if a patient has a shortening discrepancy, you did this procedure simultaneous with correction. You show polio case with severe equinus deformity of foot. And how you correct? First lengthening, then correction deformity of foot, or first correction deformity, then lengthening, or simultaneous? What is your variant?
Yes, my method, I am doing all of them together. As you know that Ilizarov frame is very good. One component I am using for the correction of the digits, another one for the ankle, and another block for the ankle and foot, another block for the leg for correction and equalization. All of them at the same time. A little bit is difficult, but the patient should hear very well, and I am doing very strict follow-up, because by doing all of them together, there will be less time consuming, and there will be very high vascularity of the limb to allow very early consolidation of the elongation part. I am doing all of them Bijlani together. But if it is remain in the femur, that will be for the next stage. In order to that, the knee will be free, because I have some cases also, I did elongation of the femur also, especially in polymyelitic patient and cerebral palsy and fibular hemimelia. But Bijlani, all of them together. Each block for one of the purpose. A block of the leg for correction of any recurvatum or oblique deformity or varum or valgus and elongation. Ankle and foot for correction of ankle foot deformity, and the digits for the clawing of the digits. Okay, thank you.
And I have one question more. If you have some patients when you separate lengthening, finish lengthening, and correction. And which result is better if you have this patient?
Yes, yes. I think first of all, we have to correct ankle and foot and digit deformity. Then one should think from the leg. In order to that, the foot will be plantigrade and to apply shoe raising, to encourage patient to walk with shoe raising, a type of brace with shoe raising. Then there will be a very rigid bone and good vascularity. Then we have to think from the correction of the others. Yes.
I have last questions. If
please.
a baby have club foot, from which age you recommend apply Ilizarov frame?
Usually, Ilizarov frame, even I use at the age of 1 year. I have some cases of tibial hemimelia. I did fibula protibia. I cut the fibula and I put to the proximal part of the tibia, and I applied the mini set of Ilizarov, but with very good result.
Thank you. Thank you very much.
Thank you.
Thank you very much, sir. Professor Mofakhkharul, Bari sir, would you have any more questions to Professor Omer sir? At that time, the network was not. Okay. Now, I would like to request Dr. Shamsul Huda sir to share his knowledge.
Yes.
Yes, sir. Yes, sir. We can hear you properly, sir. Yeah. Now, I would like to request Dr. Shamsul Huda sir to share his knowledge regarding the presentation. Dr. Shamsul Huda sir, would you please?
Yeah, thanks, Dr. Tanvir. Omer sir, wonderful presentation. Lots of learning again and different cases sir, you have been doing. I just have one question here, sir. For such complex foot anatomical deformity, do you go for correction with eyeballing or you use software for deformity correction angles and on? Like
Sorry,
something, sir.
I couldn't get your question properly.
I'm repeating, sir. Can you hear me, sir?
I can hear you, yes.
Sir, for such wonderful complex deformity corrections of foot and ankle, sir, I have one question for correction of stage-wise. Do you do eyeballing for correction or do you perform any software for calculations like Bone Ninja or something like that, sir?
All of them together. Really, I am depending on a nice book of one of our friends, Alexander Kirinko from Italy. Its title is Complex Ankle and Foot Deformities. In this book, it is very nicely, it is speaking about the correction of complex ankle and foot deformities.
One more question, sir. For such, in one case, I saw the skin condition was very bad. Do you add some plastic surgery procedure also?
Really, if you are doing reconstructive surgery, no need for plastic surgeon. That's for general orthopedic surgeon. They are consulting the plastic surgeon. Otherwise, if you are limb reconstructive surgeon, no need for plastic surgery. You have to resolve all of them.
Right, sir. That is the perfect rule, sir. Thank you, sir.
Yes, thank you. Not at all.
Sir, I have one question, sir. Do you have any recurrence after removing the Ilizarov frame of your patients, sir?
As you know, Ilizarov for smart patient. If the patient is smart, and doing proper instruction, especially night brace, there will be no recurrence. Night brace for a very long time. Okay.
Sir, how far will you continue the night brace? Is it according to the age or is there any protocol there?
In children, it is better to do it even to do follow-up till maturity. But in adult for a shorter time.
Okay, sir.
Yes.
Thank you very much, sir, for your excellent presentation and for your knowledge sharing with us. It was a great day for all of us, and it is a learning day for all of us. I'd like to thank all of our academic faculties and our honorable speaker for joining with Orthopaedic Solution Academy. And definitely, I would like to thank Raj TV and Malia CNT Specialized Hospital for helping us to arrange this type of academic program. I hope we will connect in the coming part of our program in the next Friday. I will connect with you with another magical Ilizarov topic. Till then, I am Dr. Tanvir Ashraf on behalf of Orthopaedic Solution Academy saying bye-bye to all of you. Bye-bye.
You are watching Raj TV, Jagorone, Bangladesh. Please subscribe our channel.
Это же хорошо.
স্যার একটা ইম্পর্টেন্ট একটা ছিল স্যার ওমর স্যার, প্রফেসর নভিকভ স্যার এন্ড প্রফেসর বারি স্যার